For today's video, I will be showing to you how to make the Leopold's maneuver. But first of all, let me introduce myself to each and every one of you. My name is Sabra of BSN 2-1 and I will be your guide through the NCM 107, the care for mother, child, and adolescents. Let me start by saying the definition of Leopold's maneuver. It is a systematic method of observation and palpation to determine the fetal presentation, position, lie, and attitude, which help in determining the predicting course of labor. It consists of an abdominal examination divided by into 4 steps of palpation of the gravid uterus and the fetus, factors that are affecting this performance of maneuver. First, it is difficult to perform in obese women. Because of the layer of abdominal fat, it is much more difficult for us to palpate them and it is uncomfortable for the patient. Second is woman with hydramnios. It is a condition that it's too much amniotic fluid buildup during pregnancy. And lastly, it is woman with full bladder. Due to this procedure, we are palpating areas that are usually the storage of our urine, and this might be feeling uncomfortable for the patient. As a nurse, we must be taking consideration for the following. First is to explain the procedure to our client. Second is to drape properly for their privacy. Third is to instruct the client to empty her bladder first before we proceed to the procedure. Fourth is to palpate with our warm hands to avoid tensing of abdominal muscle. And lastly is to palpate with our palms, not fingertips. The purpose of Leopold's maneuver is to identify the fetal position, fetal presentation, and aid in locating the fetal back. The materials we'll be needing for this is pillow, linen, and top linen to cover our patient. Now that we are done with the preparatory steps, we may now begin communicating with our client. First is to identify the patient. Second is to introduce yourself to the client. Third is to do the hand hygiene. And third is to communicate with a smile. Before we start our procedure, we must do our hand hygiene first before we enter the client's room. Second is to close the curtains because the rationale behind this is to keep the privacy of the client. Third is to communicate with our client by first identifying the client and of course introducing ourselves to the client.
Good day, ma'am. My name is Sabra. Your nurse will be accommodating your care for today's clinical visit. May I know your name and age, ma'am, to clarify your clinical record?
Good day. My name is Samantha Smith and I am 32 years old. Alright, Mrs. Samantha Smith. Today, your doctor ordered a Leopold's maneuver to know your fetal status and your fetal position. So, ma'am, before we start this procedure, may I instruct you to go to the bathroom and just pass the urine because this procedure might feel uncomfortable if your bladder is full. I'll just assist you, ma'am. Alright, then we will go to the bathroom to assist the client and of course to void their urine. And after that, we will be starting our procedure with this maneuver. As the client is done, we may now start to assist our client to lie on the dorsal recumbent position to relax the abdominal muscle of the client. This maneuver is the Fundal Grip. To answer the question, what lies in the fundus? Lie, it is the long axis of the fetus with regards to the long axis of the mother. We will be feeling for this the head or the buttocks of the baby. But if it is in a transverse lie or an oblique lie, it meaning that the lie it is in a vertical position.
Face the client's head. Use both hands to palpate the fundal area. Expect to palpate the soft, irregular mass on the upper quadrant of the maternal abdomen.
Maneuver is the umbilical grip. This is to know where is the fetal back. Our hand will be placing on the lateral side of the abdomen of the client. One hand will be feeling the firm, long, smooth surface. This is the fetal back. And the other hand will be feeling an angular nodulation or this is the knee or elbow of the fetus. This is important for us to know where to place the stethoscope in determining the most accurate site of fetal heart sound.
While still facing the patient, move hands to the lateral side of the abdomen. Perform this maneuver by placing the right hand on one side of the patient's abdomen while using the left hand to expose the woman's uterus to the right side. Repeat this step on the opposite side using the opposite hand.
Third maneuver is the Pawlick's grip. This is to determine where is the fetal presentation, if it is an encephalic presentation, transverse presentation, and bridge presentation, and of course to know the fetal engagement.
Move hands down to the lower pelvic area, palpate the area just above the symphysis pubis to determine the presentation part. Grasp the presenting part with the thumb and finger of the right hand.
The last maneuver is the pelvic grip. This is to know the fetal attitude, if it's good attitude or poor attitude, and of course to know the degree of flexion of the fetus into the pelvis. We're also going to know the anterior-posterior position in this maneuver.
Face the client's feet, place the hands on the abdomen and point fingers towards the mother's feet. Gently move the fingers on both hands and towards the pubic by sliding the hands over the sides of the patient's uterus.
You are done communicating with the client and documenting everything that you have find out with the maneuver, now is the time to tell your client that the doctor will let her know everything else, and of course to bid goodbye to our client. So good day again, ma'am. We are done with our procedure and that the doctor will let you know everything else that we have find out with this maneuver. And next time we will be seeing again. My name is Sabra, and next time we'll be seeing again at the clinical visit. Bye, ma'am. Take care. And that's it for the maneuvers, and that's it. As we venture the learning of Leopold's maneuver, I hope to give you a clear knowledge of what is the procedure of this Leopold's maneuver. Again, my name is Sabra of BSN 2-1, your guide through the NCM 107, the care of mother, child, and adolescents. Thank you for watching and see you on the next adventure.